What is calcium? Calcium is the most abundant mineral in the body. Do you know that the skeleton contains 98% of the body's calcium, which is used to generate ions like calcium phosphate and give the bone structure its strength? All forms of muscular contraction, including those of the heart, skeletal muscle, and smooth muscle found in blood vessels like the arteries, are mediated by intracellular calcium ions. Because calcium stimulates several different enzymes, it is essential for the creation and degradation of both liver and muscle glycogen. In addition, calcium aids in the control of hormone secretion, blood coagulation, and nerve impulse transmission. The body may eliminate some calcium from the skeleton through the action of hormones such as parathormone and calcitriol, which is the hormone form of vitamin D, if the diet is low in calcium for a brief period. This allows the body to maintain an acceptable amount in ionic form. Now we know about the function of calcium, so we move to the structure of calcium. So here is the general structure of calcium. The figure is about calcium balance in the human body. Calcium balance in an adult who needs 1000 mg every day. Out of 1000 mg, the body absorbs only approximately 300 mg or 30%, while the remaining 700 mg are eliminated by feces. 300 mg of calcium are eliminated daily. This includes 150 mg in the feces, 130 mg in the urine via the kidneys, and 20 mg in sweat. For sport and exercise, calcium supplements come in a variety of forms, such as calcium carbonate, calcium citrate, calcium lactate, and calcium gluconate, and are found in certain antacids such as TAMs. Now, let's talk about sources of calcium. Dietary calcium comes from food sources associated with dairy products such as milk, cheese, and yogurt. Other than milk and dairy products, calcium-rich foods in the Malaysian diet can be obtained from fish with edible bones such as canned sardines, anchovies, and fermented soybeans like tofu and tempeh. Lastly, dark green vegetables such as kale, broccoli, legumes, and nuts are also source of calcium. So this is a recommendations nutrient intake based on RNI 2017. A normal person who are aged from above 20 years old need to take 1000 mg, while for women who are aged above 50 years old need to take 1200 mg in their daily life. Calcium intake should not exceed a daily consumption of 2500 mg because exceeding the tolerable upper intake level regularly may increase the likelihood of adverse effects or toxicity. Next is a recommendation of calcium intake for female athlete triad, especially those with menstrual irregularities or amenorrhea and decrease in bone mineral density may have higher calcium needs to support bone health, which is 1500 mg. It is important to note that individual calcium needs can vary based on factors such as age, weight, training intensity, and overall health, and inadequate dietary intake of calcium is the major cause of calcium deficiency. Here are the roles of calcium in sport and exercise, which is bone health and preventing osteoporosis, contraction of muscle, functioning of nervous system, hormonal secretion, maintain average heart rate, and maintain blood pressure. Calcium is also particularly important for female athletes due to some of the hormone changes that happen later on their lives. It's also important for any athletes in aesthetic or weight-based sports or non-weight-bearing sports. Factors such as weight-bearing workouts, electrolyte loss through sweat, and the female athlete triad necessitate careful examination in relation to calcium needs and dietary calcium intake. One of the most important roles of calcium in sports and exercise is it can help to improve bone health and prevent osteoporosis, especially for weight-bearing exercise. Athletes for weight-bearing also need an adequate calcium intake to support the bone density and strength. Also, it can reduce the risk of fractures and stress in injuries during the exercise. Next, calcium is also crucial for muscle contraction. Our muscles are lined with calcium ions, which help enable the muscle to flex, contract, and extend. Calcium is also a helpful mineral for muscle growth. The nerve impulse from the brain improves when the calcium intake increases, and the muscles will have an easier time contracting, making workouts more efficient and less stressful. Last but not least, calcium is very important for female athletes. Female athletes may experience irregular menstrual cycle or amenorrhea, which is absence of menstruation, and this can lead to a condition known as female athlete triad. The triad includes disorders of eating, amenorrhea, and osteoporosis. So it is important for female athletes to eat enough calcium so that their body does not pull calcium from their bones and further weaken them, because weak bones can lead to higher risk for injury and osteoporosis. Is there any calcium supplement? Calcium supplements come in a variety of forms such as calcium carbonate, calcium citrate, calcium lactate, and calcium gluconate. They are found in certain antacids such as tums. Calcium from most supplements is absorbed as well as from milk, but a few calcium salts including calcium citrate or malate and calcium ascorbate have superior absorbability. Be sure to check the label for the calcium content per tablet, which may range from 50 to 600 mg depending on the brand. Be aware that some forms of calcium supplements may be contaminated with lead. Hypercalcemia never occurs from ingestion of natural food sources, but only with supplements. Excessive amounts may contribute to various health problems such as cardiovascular disease, prostate cancer, and kidney stones. Low calcium diets increase calcitriol and vitamin D hormone, which can promote fat accumulation. Inadequate daily calcium intake are tend to develop osteoporosis and impair neuromuscular functions. Effect of calcium supplementation on physical performance is almost non-existent. Calcium supplement did not affect either carbohydrate or fat utilization rates during exercise. Calcium may be combined with other salts such as lactate to form calcium lactate, which could be used for buffer lactic acid during exercise. Thus, acute or chronic calcium supplementation is not recommended as a means to enhance sport performance. However, calcium supplementation may be useful to help maintain bone mass for those who do not consume adequate calcium from foods or either female or male athletes.